Hello and welcome to Speaking of Health, a place where you can learn how to live a longer and healthier life. I'm your host, Jason Howland, and our guest today is board-certified urologist, Dr. Christopher Gran. Thanks for joining us today on Speaking of Health.
Happy to be here. Thanks for having me.
Well, September is National Prostate Cancer Awareness Month, and it's something that everyone should be very aware of. It affects nearly 1 in every 6 men in the U.S., right? Correct.
It's a very high-risk disease for men. It's very prevalent. Certainly, if a man is not affected by prostate cancer in his life, he has either a family member or a friend that is. It's not necessarily a disease that has been talked about a great deal in the past for personal reasons, but as we know more about the disease and as more people are affected by the disease, as we're able to diagnose it earlier and treat it successfully, I think it's a bit more out in the open, and most people will be affected by a loved one or someone that they know during their lifetime.
Well, what exactly is the prostate gland? Is it something that's only in men?
The prostate is a organ of the reproductive system, so it is only found in men. It's a gland that produces fluids that are important for reproduction, and it has a role throughout a gentleman's life. It becomes more prominent in terms of the impact it has on a gentleman's health as we get older. Interesting data, long-standing from the Mayo Clinic that says that if you live to be 80 years old, you have about an 8 in 10 chance of having prostate cancer. So it's not something that is surprising to see as people are living longer and healthier lives.
Well, what are some of the signs, since it happens to so many men? What are some of the signs that prostate cancer may be there?
Certainly there can be some what we would call constitutional symptoms. If you've lost 10 or more pounds unexpectedly without initiating a program of exercise or diet, unintentional weight loss, or if you've got new aches and pains, it can also have some overlapping symptoms related to difficulty with urination, slower stream, getting up more at night, feeling that you don't empty. Occasionally you can also see some blood in the urine, and that's both with cancer as well as non-cancerous processes that go on with the prostate.
In my research, I was surprised not only to know how many men actually can get or do get prostate cancer, but how many men probably don't know that they have prostate cancer because there aren't any signs a lot of times, right?
The vast majority of gentlemen that are diagnosed with prostate cancer now are diagnosed based upon a combination of either a digital rectal exam or even more so a blood test, a PSA or a prostate-specific antigen, which has been around for a number of years now. But there are a very large number of gentlemen that are completely asymptomatic when they're diagnosed with prostate cancer. Most of these are found microscopically when we do biopsies for either a finding on physical exam or when the PSA goes up unexpectedly or at a rate higher than we would like to see.
Well, I know there's been some debate as far as the starting age of when you should get prostate cancer screening. But for the most part, I guess, what do you think is probably the best age for a man to start getting regular prostate cancer screenings?
Traditionally, the screening was beginning at age 60, and I think that's very similar to what we've seen in the past with things such as colon cancer, although those ages for screening have crept down as well. Most of the groups that recommend screening state either screening at age 50, or a few, like the American Urology Association, recommend an initial screening at age 40. There's some variation. A number of experts in the field are very adamant about early screening because of the added benefit of identifying people at higher risk earlier on, so that if we, much like colon cancer and colonoscopies, if you get screened or we find a small little polyp or an early physical finding, oftentimes those are the most easily treated. Doesn't involve extensive surgery, doesn't involve other things that people get concerned about like chemotherapy or radiation. So the goal of most screening programs for whatever cancer is to identify when it's the easiest for the patient, as well as when it's the most treatable and when we can improve the long-term outcomes so that those cancers don't cause any problems down the road.
Yeah, why not err on the side of caution and start those at age 40 instead of age 50 or age 60,
sure.
Right?
And a number of experts, like a lot of cancers, there are expert recommendations, and then there are panel recommendations. Some of the more prominent experts in prostate cancer recommend a screening at 40, particularly if you have a strong family history. Your father, a brother, an uncle, a first-degree relative has had prostate cancer, especially if they've had prostate cancer develop or have been treated for prostate cancer before the age of 60. And then if there are other genetic risk factors, such as the fact that we know that African American gentlemen do have a higher rate of prostate cancer, higher grade disease, more aggressive disease at earlier stages that really merits us screening more aggressively so that we do pick those up at an early treatable stage.
Are there other risk factors like diet or exercise, smoking, that kind of thing? The
interesting thing about prostate cancer, as we learn more about it and as we have more long-term data, is that there does seem to be some very strong environmental impact associated with diet, as well as other health issues. There's a very low risk of prostate cancer in certain Asian populations, but if those gentlemen then immigrate to the U.S. and then change their diet, their risks within a generation essentially re-equilibrate to what the typical American or a more typical or prototypical Caucasian American and the risk profile is. And the thought is that it's definitely impacted by diet. We know that for both the development of prostate cancer as well as the impact of diet as people are treated for prostate cancer, a high-fat diet, an unhealthy diet can definitely negatively impact both the development as well as survival. So there's a role for a heart-healthy, low-sodium, low-animal fat diet, both at a younger age to prevent development or delay development, as well as for someone that's been diagnosed. If I've diagnosed someone with prostate cancer and they've been treated, or if we're watching them, whatever we've decided to do, a strong component of that is always talking about dietary modification and trying to both reduce the impact that has on the prostate cancer as well as overall health. Because the interesting fact about prostate cancer is that although we diagnose a large number, there are millions of gentlemen living in the U.S. with prostate cancer, they still tend to have their number one cause of death still is cardiac. So even if you've been treated or you're a prostate cancer survivor, the most important impact that you can have on your quality of life and the longevity of your life is actually to eat a good diet.
Good words of advice.
I think that as we learn more about all kinds of cancers, we'll specifically look at the impact of diet, exercise, lifestyle, smoking, and the impact that has on outcomes.
Well, how is prostate cancer treated? Is it just like any other cancer where you go through radiation and chemotherapy, or is it different?
Traditional prostate cancer options include surgery, removing the prostate, the entire prostate, or radiating the prostate, external radiation. There are also implantable seeds that can also deliver radiation. Sometimes that's used in combination. There are also medications that specifically target the testosterone pathway as it relates to the prostate. And a fair number and an increasing number of gentlemen that are diagnosed with prostate cancer will be observed, because as we learn more, we know that there are certain prostate cancers that are lower risk that we can more safely observe, particularly if there are other health issues, if there's other negative things that have put them in the hospital or have made them chronically ill.
So I'm a man over the age of 40, and I've never been screened for prostate cancer before. How do I go about doing it?
Well, I think if you're 40 and you haven't seen your doctor, it's certainly appropriate to establish with a primary care physician. The primary care physicians at most facilities, and certainly at Fairmont Medical Center, are very well versed in all the different cancers that need to be screened for. I know that I've spoken with the primary care physicians to go over topics like this as well, so that they are more comfortable, and because the recommendations do change all the time. The recommendations for normal PSA have changed over the past 5 years, and we try to take all those things into account and make sure that we stay on top of what's appropriate for both initial monitoring as well as diagnosis.
All right. Well, great words of wisdom. We want to thank Dr. Gran for joining us today on Speaking of Health. Some great information on a very important topic of prostate cancer. Thanks for joining us today.
Pleasure being here. Thank you.
And the phone number to make an appointment with one of the urologists at Fairmont Medical Center, either Dr. Christopher Gran or Dr. John Holstein, is 507-235-6036. And that's all the time we have for today here on Speaking of Health. Thanks for joining us, and be healthy.